In an important record, which is count 2021 neurofibromatosis. The task was this: neurofibromatosis discovered while admitted with pneumonia. So task is tell the mother about the diagnosis and answer the questions. Here, mom is asking if she has the same disease, should she seek medical advice, how is the disease inherited, follow up and team is involved. Okay. So child pneumonia suddenly we discovered he has neurofibromatosis. As usual, we are IRCAP introducing myself, making a report, taking the consent, agenda I will tell, and the attendance and prior knowledge. So first tell me how much do you know about Ali's conditions? Actually, I know he has a pneumonia. He has anything else. In the matter of fact, when we examine Ali, we discovered that he is having some dark spots on his body and some rash in his armpits. Also, he is having bowing of his legs. What do you mean by doctor? We are suspecting that he has a condition. It is called neurofibromatosis type 1. So we'll tell that like we after examining Ali, we found here is some rash, some spot on his armpits. So we are suspecting he has a condition that is called neurofibromatosis type 1. So what is that? Mom is asking. So neurofibromatosis, it is what we call multi-system disease. It may affect many systems in our body. It is really wide range. It may be just presenting by skin lesions, but may also have associated conditions. So it has a multi-system disease. What are the associated conditions? Here on the task, Mama is also asking how it affects. So first, and unfortunately, this disease may cause bowing of his legs, may cause deviation of his vertebral columns. So we'll follow him up with the bone doctor. So we need to follow up the bone doctor because neurofibromatosis causes bowing of the leg and deviation of his hip bone. Okay, and also unfortunately, this disease may be associated with brain tumors. That is why it is very important to follow up closely to pick up any early tumors and interfere immediately with the our nerve doctor and even nerve surgery. But not necessarily this will happen. Are you with me? So every time we tell the problem and the solution. So this is also brain tumor associated with that. That's why we need to close pick up that follow up. You will be under follow up. If there is anything we find, immediately will interfere and nerve doctor will involve. Next, also it may be associated with the condition in the heart. So we'll do the jelly scan on the heart by our heart doctors to make sure that his heart is okay. Am I clear? Okay, doctor. Some children, of course, not all children may have the narrowing of the kidney, blood tube. So that we will also do the jelly scan of his tummy to make sure everything is okay. And even if he has this narrowing, we will follow up with the kidney doctor. So we are telling neurofibromatosis is a multi-system disorder. It affects first brain tumor. That's why we are involved. The nerve doctor, heart also affected. Heart doctor jelly scan will do, and kidney blood tubes narrowing causes. That's why kidney doctor will involved. So multi-system, all the system we are involving. Then mom is asking, okay, doctor, I got this rash. Should I do screening for myself? Actually, best one is to answer your question is the adult doctor. If you want, I can arrange a meeting with him, but most probably you need to be checked. So we know neurofibromatosis type 1 is a autosomal dominant conditions. So it's checked needed and it's by adult doctor. What about his brother? Unfortunately, this disease is run in genes and that is why we need to check his brother and sister. So family member also need to be checked. Then can we ask that why will he catch his height or not? So height catch or not answer is that according to the puberty is if he started puberty at earlier age, he will not catch height. But if still not in puberty, there is a chance to catch the height. Okay, if planning for pregnancy, we'll have children with the same condition. So next pregnancy, we have 50% to have children with the same condition in every pregnancy if one parent is affected. But if a parent is not affected, then there is a risk of 2 to 3%. So parents is affected, then 50% chance of the next child. And if not parents affected, then 1 to 3%. The good news is that there is no other members in family with same conditions. It will be like as other populations. So we have a very minimal chance to have other children with same conditions. Do I need to screen all my family? We can do examination to exclude these conditions. So mom is asking, I have only one capulate macule in back. Does it mean that I have neurofibromatosis? We just mentioned that how we diagnose the neurofibromatosis. One capulate macule is not a sign of neurofibromatosis. We should have at least 6 capulate macules and the size must be 15 millimeter and we should have another criteria to diagnose. So till now you are not neurofibromatosis, but to be sure about that, I will refer you to your doctor to do full examination to see if there are other signs of neurofibromatosis or not. So ma'am is asking the mother that she has only one neurofibromatosis. Does that she means that she has neurofibromatosis present or not? We will tell that the adult doctor should need to examine you because at least 6 K spot needed and their size also matter 15 millimeter and also some other features. So after examination it will be confirmed. Like ending, do you have any other concern? Summary, trusted website, written leaflets, and support group. So this neurofibromatosis communication is usually we tell what is neurofibromatosis and the multi-system involved and also communications. All family member can be affected. Also next pregnancy affected. Height, how already tell. This is all about this communication. Thank you very much.